This is a University of Iowa Children's Hospital Medical Mini.
The Mother's Milk Bank of Iowa is one of 11 member banks of the Human Milk Banking Association of North America. And we're a nonprofit milk bank. We collect milk from volunteer donors in our community. We process and pasteurize that milk, and then we dispense it to babies that are in need of it.
I think someone actually told me at a party when I was talking about what a shame it was to be throwing away milk that my son didn't need since I'm exclusively pumping. And I knew how important breast milk was to a lot of babies. My midwife mentioned, well, what about giving to the Mother's Milk Bank? And I said, what is that? I've never heard of a milk bank. And she explained it to me and I thought, perfect.
Human milk is very valuable. Human milk is the ideal diet for all human infants. And there are some infants for whom their mother's own milk is not available, and it's felt to be better for them to have human milk than to have formula, and so we fill the need to provide that needed milk for those babies. It is a prescribed substance similar to a very special formula or a medication, and so you need a doctor's prescription to receive donated milk.
They do blood tests to check for a variety of diseases to make sure that you're healthy. They give you little containers and labels, and you can donate as little as 1 ounce at a time, or they're 4-ounce containers. So we're not talking about huge amounts of milk.
While they were in the NICU, little Josh here got a viral infection that was pretty life-threatening. I knew the benefits of breast milk and boosting their immune system, and so Tom and I, had a discussion, and it was sort of hands down, no more formula. We were going to breastfeed them. Dr. Ziegler at the time recommended the donor milk bank, and it's been a blessing.
We're equipped to take care of any neonatal problem that exists. We're one of the highest level NICUs in the country. And so we take babies from 23 weeks of gestation, which is 6 months pregnant, all the way through big term babies who have severe cardiac disease, heart problems that need surgery, severe bowel problems, birth defects. But despite all that, we have excellent outcomes for the babies that we take care of in our NICU, particularly our small preterm infants. We pride ourselves on taking excellent care of them and producing babies that are healthy and happy and indistinguishable from their peers.
I don't know, I'm just so grateful it's there, and I can't imagine what we would do without it. The way they thrived, I can't believe the weight gain. They went, from 4 and 5 pounds to 16 and 15 pounds now.
The nurses in the NICU would call it white gold, and it really is, it's white gold. We really think it saved our boys' lives.